Hello and welcome to the next installment of our work on health literacy. This video addresses the relationship between culture and health. Understanding this relationship will help you become a culturally effective and health literate provider. The definition of culture that we will be using comes from the Health Resources and Services Administration, or HRSA, which says that culture is the attitudes and behaviors that are characteristic of a group or community. While this definition sounds mild and somewhat vague, what it is really important to remember about culture is that it influences all aspects of human life. That, of course, includes one's health. Let's dive into that a little deeper and think about some aspects of culture that affect health. Pause the video and think of or jot down some examples, then press play again when you're ready to proceed. Let's look at the list of examples that the Agency for Healthcare Research and Quality developed and compare it to the one you made. Number 1 are people's health beliefs. This can be anything about what people believe causes, exacerbates, or prevents health conditions. Next, health customs. In some cultures, for example, family members play a large role in healthcare decision-making. There are also ethnic customs. For example, differing roles of women and men in society may determine who makes decisions about accepting and following through with medical treatments. Religious beliefs can also play a large role and may affect healthcare-seeking behavior and people's willingness to accept specific treatments or behavior changes. Dietary customs are one of the more tangible aspects of culture that affect health. Disease-related dietary advice will be difficult to follow if it does not conform to the foods or cooking methods used by the patient. And the last one on the AHRQ list is interpersonal customs. These customs can have an enormous impact on the way your patients or clients interpret your interactions with them. Expectations for making eye contact, maintaining physical spaces, initiating touch, and so on can vary. What you may see as respectful could be seen as inappropriate or offensive to someone else. So what does all of this have to do with health literacy and health communication? Well, limited health literacy is extremely prevalent in the United States, and according to the U.S. Department of Health and Human Services, some groups, including adults older than 65 years, racial and ethnic groups outside the dominant culture, and non-native English speakers, are particularly vulnerable. For these vulnerable groups, receiving care from a culturally effective provider can make an enormous difference. Put yourself in the shoes of someone going to a healthcare appointment. Now imagine that you are receiving therapy from someone who speaks a different language from you. Imagine you've had previous experiences with a healthcare professional who was dismissive of your culture or who treated you disrespectfully. Any miscommunication due to cultural or linguistic barriers coupled with anxiety or mistrust is going to impact your ability to effectively communicate with your provider, which will affect the amount of information you understand and retain. Cultural effectiveness is a component of good health communication, which is a key ingredient to good health literacy. Fortunately, there are evidence-based strategies you can use in practice to become a more culturally effective practitioner. These strategies alone cannot solve the deeply embedded disparities in our society, but they can help you think about your own role and how you might provide equitable services to all of your clients. Let's take a look at the strategies. Number 1, directly address patients' cultural values, specifically in the context of their healthcare. Asking about your clients' religions, cultures, and ethnic customs can help you engage patients and establish trust so that together you can devise treatment plans that are consistent with the patient's values. The following slides have some sample questions that can help you get started. Is there anything I should know about your cultural beliefs or religious practices that would help me take better care of you? Do you have any dietary restrictions that we should consider as we develop a food plan to keep you on track? Is there anyone from your family or community you would like involved with your care? How would you like them involved? Do you consult with anyone else in your community for treatment advice? Number 2 on the list of strategies, avoid stereotyping based on religious or cultural background. Understand that each person is an individual and may or may not adhere to certain cultural beliefs or practices common in his or her culture. Asking patients about their beliefs and ways of life is the best way to be sure you know how their values may impact their care. And last on the list of strategies, use translators and materials that are translated into a client's preferred language. All federally funded health organizations are required to provide translation services for patients. Even if you're not at a federally funded location when you eventually practice, it's a good idea to use translators and provide multilingual health information whenever possible. You can imagine that becoming a truly culturally effective provider requires information. Where might you go to find information about the impact of implicit biases on your health of your clients, or information about health inequities across cultures, or the impact of cultural beliefs and traditions on healthcare decisions, or healthcare information in multiple languages? The Bellack Library, of course. We put together a guide packed full of websites, books, ebooks, journals, and articles that can help you find answers and be a resource for you on your journey to becoming a culturally effective provider.